It's a pleasure and an honor for me to open the scientific part of the meeting. I'm Len Sander. Eshel was a longtime friend and collaborator. We have a very full schedule, and we're going to try to keep to time. So there are 20-minute talks. I'm going to give you a 5-minute notice. See the 5-minute notice? Okay, and at that time, I will expect you to finish up and leave some time for questions, but we're going to try to strictly stay to 20 minutes for each talk. Okay, I'd like to call for the first talk. It's Shai Efrati, Brain Effects of Hyperbaric Oxygen.
Okay. This is a mentor. And if we are speaking in this conference, the topic of this conference is simplifying complex biological system. And if you are thinking about the most complex system that we have in our body is the brain. And if we want to understand how complex it is, you can look over here and see this is a brain cell, and this is the universe. So this is what we are targeting to. This is what we are trying to do. And this is only looking at the cellular level. Think what we have below and above. And if we want to target such a complex system, how can we simplify it? Okay, I'm coming from the practical point of view. We want to create harmony. We want to improve the organic tissue. We want to correct damage. So looking at such a complex system, I'm saying from ahead that I cannot understand the system. What we need to do is look for the switch, for the on switch. If we can mark the on switch that can trigger the system to start working, maybe we can make a change. Maybe we can rejuvenate this complex system. So we have to look at the brain in a different way. We can look at the brain from the thermodynamic point of view instead of looking at the synaptic level. And if we are looking from the thermodynamic point of view, the brain is up here. It's 2% of our body mass, but this 2% take 15% of the cardiac output, 20% of the overall oxygen consumption, and 25 to 30% of the overall glucose consumption. I'm always saying every time that if you want to make diet, the best way to make a diet is just to think some more. Okay, that's what you need to do. Okay? It's amazing because if our body, from an energy point of view, we have the brain who is only, it's 2% of our body, but it takes 20% that if all our system work on 80% that. Amazing. It's even more amazing than that, because at each time point, the brain utilizes only 5 to 10% of its potential. And the simple question that we should ask all the time is why? Why only 5 to 10% is being utilized at each time point? And the question for that is, again?
What is it based on?
It's a theoretical base because he's marking with the 5 minutes in few minutes, okay? I will not get into that. This is a different lecture that we can discuss differently afterwards. And the question is what? We see it on the daily routine, okay? For example, if we are speaking on the cellular phone, we will miss the turn. Probably the answer for that is that we don't have oxygen for more. At each time point, the brain is utilizing all the oxygen that is being delivered. And we can use that when we are doing functional MRI. We are looking, if we are moving the hand, we see perfusion to the area that is responsible for the hand moving. If we will look the leg, it will go to the leg, etc., etc. And if we will speak on the cellular, we will miss the turn or forget the child in the car. It's a biological limitation. Mostly to when, yeah. With related to the child, yeah. And we took that challenge into a next level. We know that we have a limitation of doing motoric and cognitive function altogether. And in order to evaluate whether oxygenation is the limit, we are using the hyperbaric oxygen chamber. There we can play with the oxygen, and by increasing the oxygen supply to the brain dramatically, we can see that healthy people, healthy volunteers, can do more mutual cognitive and motor tests together. So yes, the oxygen is indeed rate limiting factor for brain activity. You are looking at this terrified, and this is the purpose of this slide, okay? This is an ulcer in the leg. We used to looking at that, some of us used. And if we will look at this ulcer, we will say that this part is completely lost because it's necrotic. But in the surrounding of the wound, over here, we know that if we will have enough oxygen supply to this area, if there will be enough stem cells in this area, this part will rejuvenate, will cure. Over here, we are looking on the same ulcer. The only difference is that we are not used to looking at it directly. We are used to looking at the brain in CT scan, in MRI, in high-tech technology. But it's a tissue, a simple tissue with a simple wound. It's not a simple wound, it can be a complex wound, but the same demands that holds over here holds also for this complex tissue. We can visualize this area. We can visualize it with different metabolic imaging of the brain that we can do, PET-CT, SPECT scan, etc., and we can see a necrotic tissue, which is the blue area over here, and the surrounding is the metabolic dysfunction area. This is where we are targeting our treatment. And this area can persist for years after the acute event. One of the major things that we proved is that oxygen is indeed a rate-limiting factor for brain recovery. And the first proof for that is coming from patients that have severe traumatic brain injury. Why is that? Because in patients with severe traumatic brain injury, we have the licensing to attack the patient and be in direct contact with the brain. You know that we are inserting different catheters. And this is an amazing study that was done, which took patients with severe traumatic brain injury, in which we have direct catheter to the brain, and we are evaluating the brain oxygenation. One group is going into the chamber, hyperbaric chamber, increasing the oxygen significantly, which is this group. The other group received normal oxygen, and the last group is the control group, didn't receive anything. What we see is if we are taking the patient into the chamber, the oxygenation increased dramatically, and it stays in the brain tissue for a prolonged period of time. So you're saying, okay, big deal. You are giving more oxygen, and you have more oxygen in the tissue. But the main question is, was this the rate-limiting factor for the brain activity? And for that, we are measuring the brain metabolism. And what we can see clearly over here, that the group that went into the hyperbaric chamber have significant increase in the brain metabolism. It's like somebody who's walking in the desert, okay? It doesn't have any water, and it starts to walk like this. You give him water, and he starts to run. So indeed, the oxygen is a rate-limiting factor for brain activity. Different researchers who are focusing on basic research evaluate what hyperbaric oxygen is doing to the brain from different perspectives. There is a group that works on the BBB, on different channels in the brain. And what all of them see is, for example, the group that works on the BBB said, hey, I know how hyperbaric is working. It's improving the BBB. It's improving the sodium-potassium channels, et cetera, et cetera. But this is what we are doing. All we are doing is we are turning the switch on. We are changing the environment and making it possible for the general rejuvenation process that we have in the brain to occur. So we spoke about energy, but there are two more things that we need in order to gain rejuvenation. And the two other things is stem cells and angiogenesis. Stem cells are very unique cells that we have. It's our spare in the body. And the stem cells have unique metabolism. They are doing anaerobic metabolism in a type of hibernating. And the signal for stem cell to start to proliferate is hypoxia. Now, as you all know, I'm a physician, so I will not take patient and stop their breathing or heart rate in order to induce hypoxia so the stem cells will start to proliferate. But what's interesting at the cellular level, like it happened in our society, is there is no absolute values. Everything is relative. And the cell, as us, for example, I will feel poor or rich, not according to what I have, according to what my neighbor has. If my neighbor has less than me, I will feel very rich. And if he has more than me, I will feel very poor. Same thing happens at the cellular level. And we are using that in order to induce the sense of hypoxia. What we are doing is when we are taking the patient into the chamber, we are increasing the oxygenation. After it's been increased for a certain period of time, we are doing a fast decrease of the oxygen. And at the cellular level, what is being sensed is the hypoxia. And this is the trigger for the stem cells proliferation. And the stem cells indeed start to proliferate. And what you see over here, these are patients that are coming to hyperbaric chambers to repeated treatment, and we are evaluating the stem cells in the blood. This is the basic after the first treatment, after 10 sessions, etc., etc. And you can see that the circulating stem cells, the one that being induced in the bone marrow, start to proliferate very fast. And in this period, it's like we are going back into the embryonic period. We have huge amount of stem cells that are going all over. We know how it works. We know how to block it today. We understand the process better. And what is very interesting is that we can induce stem cell even at the brain level, at the tissue at the brain, at the glia level, okay, which is of highly significant to everything that is happening in the brain. And we can see over here by inducing hyperoxia and decreasing it immediately, which is synonymous to hypoxia, we are inducing the stem cells. This is a wonderful study done on mice, which are taken into the hyperbaric chamber. And we can see that after hyperoxygenation and decreasing the oxygen fast, there is an increase in HIF. HIF is hypoxic-induced factor. It's supposed to be induced in hypoxia. And here we are inducing him by hyperoxia and then going back fast to normoxia. More than that, we can see angiogenesis in the brain. This is rat and mice. We are not rat and mice, of course. Our brain is different, okay? Completely different. And in a minute, we will see that it happens also in human beings. This is the first study that we have done on post-stroke patient. And without Eshel, I think that all the analysis of the brain imaging that we are doing today could not have done. And I will let you see what's going on over here. This is a combination of the anatomical together with the metabolic imaging of the brain. And by the help of Eshel, we were able now, and now it's routine in our centers, we can see the activity of the brain on the anatomy and categorize it. The blue area are the necrotic area. This area, we don't have any tissue over there, so we cannot rejuvenate, at least not today, anything over there. The green are the metabolic dysfunction area, and the yellow and the red are the well-active area. In this example, you can see that this woman could not move her right hand and leg for 14 months. She's part of the study. And after the treatment, we can see that this area responsible for the hand and leg movement start to be activated. And indeed, in the clinical, she start to move her hand and leg. She cannot speak. This is the Broca area, cannot say a word. She has aphasia. And after the treatment, you can see that the Broca area was activated and she can speak again. What's important to understand is that the necrotic area, as you can see it over here, the necrotic area cannot be rejuvenated yet. This is for Zami, yet, cannot be rejuvenated yet. okay? But the surrounding area can be rejuvenated and reactivated, and by that, you can also set the expectation with the patient. You can say, I don't think I will help you with the hand, but the leg or the cognitive function can improve. Today, we have more data, and there are a lot of researchers who enjoy the time in the hyperbaric, especially because for the first time, we have patients with malfunctioning neurological problem, and then after 3 months, it's reactivated. It's important, study was focused on memory. It's important because we have the brain imaging, so everybody is enjoying to map the specific area, because for the first time you have a patient with a kind of deficiency, improve, you can do the correlation and see what area correlates to what function. Traumatic brain injury, which is also a very significant area of research that we are doing. I have 5 minutes, so I will go fast. And in this area, we can see also the improvement. What I want you to see over here is this one. This is a perfusion MRI of the brain. Patient 10 years or more after the acute event, you can see the cerebral blood flow, before treatment, after treatment, and this is the change. Everything that is marked in red is more than 50% improvement. So what we see in front of our eyes is angiogenesis in the brain. Not in rats, not in mice, we see it on human beings. And once we are changing, and once we are creating angiogenesis in the brain, it means that we can change the environment and give the needed environment for the rejuvenation. And based on this, we can see now this amazing thing. This is an article that is going to be published soon. This is DTI of the brain, where we can see the white fibers of the brain. Again, it's more than 10 years after the acute injury. This is summary of 15 cases that were treated in the hyperbaric. This is the pre-treatment and after treatment. And this is very exciting to everybody who is treating the patient, and of course it's coming simultaneously. The big project we are working on now is on aging, standard aging. What happened with aging is that we have micro-infarct in different parts of our body. It happens in the brain, but it happens also in other tissue. And this is an example of the research we are doing now. This is a 70-year-old male, normal, healthy, fully active engineer. And over here we can see the blood flow in the brain before treatment, after treatment, and this is the change. If we are looking at the different function of the brain, we can see that this is a 78-year-old male, but over here it looks like he's 20 years younger with everything that's related to the brain activity. And it's not going only with the brain activity, of course. It happens in other parts of the body, like you see over here. For those of you who do not recognize it, this is the penile, okay? This is the perfusion in the pin before treatment. After treatment, the angiogenesis is going all over. And for those of you who don't know it yet, this is the brain, the small brain, and this is the large brain, at least of half of the people in this room. This is before treatment, and this is after treatment. So thank you very much, and especially thanks to Eshel.
Okay, we have time for a couple of questions. Yes?
Sure, really nice, but you know where the real balance between high level of oxygen and oxidative stress, because in the brain it's such a high metabolism, is really very vulnerable to oxidative stress. The question is whether if you overdo this kind of thing, you won't have in a long term, problem.
So first of all, this is a good question that a lot of people ask, but the stronger trigger for oxidative stress, which is malfunctioning of the mitochondria, usually is the cause, is hypoxia. So if you are improving an hypoxic tissue or ischemic tissue, you get the opposite, okay? So you get the opposite from oxidative stress while you are treating in the chamber. Of course, everything is dose dependent. And if we will take somebody and put it enough hour with high pressure, et cetera, you will get something that is not good for the patient. For example, I can take each one of you into the chamber for a certain time point with a significant increase of the oxygenation. I can cause epileptic seizures to each one. It's in my hand, okay? Because you are increasing the brain activity to such a level that you will get epileptic seizure. So everything is dose dependent and have to be accommodated accordingly. Based on the protocol we are using now, it's fully safe, and the opposite happened, which is very interesting.
Okay, one more.
So this is, of course, really amazing treatment, and you're closing beautifully some nice research questions. But just for completeness, it's important to say that MRI is not possibly not sufficient. Okay, so there are cases where the MRI is not actually telling you the best story.
You are absolutely right. And what I can tell you now, everybody knows who's speaking, yeah? You have to stand up. Professor Nathan. So what Nathan is doing is amazing thing. He's doing EEG analysis of the brain. And I can give you an example. There is a child that has anoxic brain damage, severe anoxic brain damage. And of course, he applied for the treatment. We have study also on anoxic brain damage, not on children, but on adults. And he came to me, I looked at the MRI and said, this is a terrible MRI, there's nothing we can do about it. And then I get a call from Nathan. Nathan tells me, hey, Shai, I did an EEG of the brain. I think that something can happen. Take him into the chamber, we will evaluate the EEG pre and post-treatment, and we will see what's going on. I said, Nathan, if you're asking, we will do that. The child went into the chamber. Nathan recorded his brain activity before and after, which was amazing, because you see that when you are increasing the oxygenation, you see a significant increase in the brain activity. It's his question, it's his time, not mine. You see a significant increase in the brain activity, and we are giving the child treatment now. What I can say that now it is possible to communicate with the child. So your notice is absolutely right. On the MRI, we are looking only on the anatomy, and it's not enough. It's not enough.
Cool. Thank you.